Welcome to the Care Smarts 360 on air, a home care podcast. I'm Mike Paladino, an account executive here at Care Smarts. Home care policies greatly contribute towards bringing accessibility, cost effectiveness, and a better state of well-being amongst individuals in the industry. Nevertheless, there are still many challenges that caregivers, elderly adults, and agency owners face in terms of achieving their better outcomes. And certain changes or improvements in home care policies can facilitate achieving exactly these outcomes and, sooner for that matter. Our guest for today, which I'm very excited about, is Doug Robertson. Now, Doug is a home care regulation and advocacy professional who offers compliance, licensing, and government reimbursement guidance in the senior care sector. Doug is thankfully today going to be sharing insights on the policy scene, the gaps, and recent updates in the home care industry as he understands them. Doug, welcome to the podcast, and thank you for joining us today.
Thanks, Mike. It's good to be here, and looking forward to the discussion today.
Yeah.
I think home care is really an exciting environment, particularly from a policy standpoint, as we know the importance of care in the home, and policymakers, I think, are very much more aware of the significance of the home setting now than ever before.
Yeah.
That was accelerated by the pandemic and the response to the pandemic and the need to keep people distant from others, as well as get them the care that they needed. And so I think flowing out of the pandemic, we have seen an acceleration of interest in care in the home and the policy that affects it.
Yeah, absolutely. And I think you're definitely bang on with the pandemic really kickstarting a lot of the new policy changes and revaluations, right? Especially across the country, we saw long-term care. There was a lot of a struggle there, a lot of elderly in the home in the long-term care facilities with the outbreaks and people not being able to see their loved ones. It really put a big focus on having care provided in the home. And I think that's something that we'll see more and more and more as time goes forward. So again, really appreciate you taking the time, Doug, and very excited to learn more about your thoughts, your understanding, and your feedback about what you've seen in the industry as well. So, Doug, the first question I have for you today is how can home care agency owners and their staff shape home care public policy?
Yeah, I think it's important for home care agency owners to block out some time in their schedule. And I know they're busy and I know they're pulled in 1,000 directions, but there needs to be some time spent on advocacy and relationship building with their elected officials and engagement in trade associations that represent the provider and the client and the home care worker and their interests. And by getting together under the umbrella of an association membership, they can really magnify their voice and not feel so alone, sometimes targeted or forgotten in the public policy debate around care in the home. And so I would encourage home care agency owners to join the association that represents them. And depending on the acuity level of their patients and the services they provide, there's a couple of associations that might be fitting, whether it's the National Association of Home Health and Hospice, or it's the Home Care Association of America, and then there's various other coalitions and groups. I think those two associations probably capture most of the audience for this podcast, but there could be others. And then engage in the association activities. If they have a call to action, you want to participate in that and send a letter, a message to your member of Congress or state legislator or the governor. But spend some time outside of making requests and just getting to know your policymakers. State legislators particularly have coffee with sessions back in their home district. It's a little more relaxed than the frenetic activity of the state capitol and the catacombs of their state legislature. And so they'll have some informal get-togethers, go do a meet and greet, and just spend 5 minutes
Yeah.
introducing yourself, talking about what you do, the value of home care, and then if there are specific times that you can block out, do a 30-minute meeting in their office. It may be with their staff member. That's okay if you can only get in to see their staff member. The staff in the legislator's office do a lot of work. They keep their boss informed
Yeah.
and bring along some association materials on issues important to you, and then tell your story. I can't overemphasize that enough. You have to
Yeah.
tell your story. Why did
Absolutely.
you get into home care? Why is it important to you? If you can, relay a story about your caregivers and how you helped your clients, the value of your business in your area as a creator of jobs.
Hmm.
We need to emphasize the vital part that home care agency owners provide in their community and make sure legislators know about it and not just when we need something.
Absolutely. And I think you hit the nail on the head with that last comment, Doug. It's being proactive and knowing that largely a lot of agencies that have started or providing a service, there's a motivation behind that. Maybe they saw a loved one have maybe not so great care from a facility or something, and that motivated them to do something different. And through these learnings and through being proactive, it allows us to learn what are the gaps and what can we do? What does our voice land where we can maybe make a difference and impact change? And I think getting involved with the Home Care Association of America or those coalitions, I think that's a great place to start because there's always recruiting and looking for new members.
Mhm.
And we go to conferences all over the country every year, and really it seems like each call them a coalition or call them the association, they grow every year. And that power is insurmountable because that means there's more of a voice, there's more people giving feedback, and there's more learnings to be had. And it's such a collaborative industry. I love the collaborativeness because it's not like we all know the answer to everything. We're always trying to learn, what did this agency do differently? How do we get more efficient? I think the last time I spoke to somebody as an influencer in the industry, we were talking about marketing and how we can automate a lot of those processes to help with making it easier to focus on agency-specific growth efforts and other things like that, right? So it's always it's call it a cogwheel, right? Something's always spinning and it's always something to focus on. And this right now, what we're talking about is super important and cannot be understated because again, especially with new and ever-changing compliances, we got to be up to date and we have to learn, especially if we handle Medicaid or veteran affairs billing, because if we don't have the right compliance in place, if we have incorrect details on our forms or on our APV data or whatever we're sending over for the claim, that gets denied, we don't get paid. Another big problem, right? And there's other things we can do to manage those efforts. But again, great response, and I'm very eager to learn more about how you've been able to make some of this impact as well. So, Doug, the next question I do have, which is kind of piggybacking off the last one. What are some of the biggest challenges, facing individuals and families seeking home care assistance, particularly in light of the current policies?
I think cost of care is a driving force behind a number of things that home care agencies and clients, potential clients, are facing. Our country does not have a federal long term care benefit
Mhm.
for assistance, ongoing assistance with activities of daily living. Uh, and in the absence of that, I don't know that consumers have really planned ahead and saved and prepared themselves for as much as 20 to 30 years of non working years
Mhm.
in the latter part of their life when there's probably more healthcare costs than at any other time in their life.
Yep.
And so as a result, what we're seeing are a lot of folks not prepared for the cost of long-term care in any setting. And even though the home setting may be the, the least expensive, I don't even know if we can necessarily say it's always affordable anymore, but it's the least expensive.
Yeah.
Uh, they're just not prepared for that, even that cost. And so I think a lot of folks are spending down their assets and winding up on the Medicaid rolls in their states States then have to grapple with significantly higher Medicaid enrollment. They don't have the funds for it. And so the cost of care is putting pressure on families and policymakers alike. Uh, Wage growth in the home care sector has also increased, which is probably the largest driver of the rising cost of care. And wage growth is needed because
Yep.
caregivers should be provided for, and their needs need to be met. Uh, and that's just a humane response.
Yeah.
So we need some other level of funding, and it can't solely come from Medicaid and burden that system. So states now, in the absence of congressional activity to create a federal long-term care benefit, states, I think, are stepping up to the plate. We have seen
Yep.
Washington create a long-term care tax, a payroll tax that the citizens of Washington have to pay for, much like they pay into Social Security and Medicare. Now they're going to pay into a state long-term care tax,
Mm-hmm.
and they are paying into that. And in the coming years, the early beneficiaries will be able to recoup those benefits. It's $36,000 a year of long-term care benefits for those
Wow.
eligible over
Mm-hmm.
the course of 2 years. And, a lot of folks on average, according to the surveys I've read, need about 2 years of long-term care assistance at the end of their life.
Mm-hmm.
And family and others kind of step in to meet the other years of need that they might have if they have needs. Of course,
Yeah.
not everybody needs long-term care, but most do. And so that's Washington's response.
Yep.
In California, an actuarial report was issued for the California Long-Term Care Insurance Task Force in November of last year. And that group put together an estimate of creating a similar benefit in California, which of course is a huge population. Minnesota is also looking at such a state long-term care benefit.
Yep.
So the states are trying to create a benefit to keep folks off of Medicaid, but also provide some type of public assistance for long-term care
Yeah.
to address that driving force of the rising cost of care. So I think cost of care is the number one issue. A lot of people are focusing on it, and we're seeing a lot of things happening. And I work for Right at Home, and Right at Home is a member of the Moving Health Home Coalition, which is supporting legislation in Congress that would also add a small ongoing assistance with activities of daily living benefit in original Medicare.
Yeah, and I think, one of the things you mentioned to me right now that really stands out was how, caregivers, the wages are increasing, which is a positive thing, right? I think it can't be understated how challenging our industry is. I've seen it firsthand. Now, I haven't been a caregiver myself, but my mother was a nurse for 35 years, specializing in home care and healthcare and hospice. So I got to, by extension, watch her go through the I call it the change in the industry, because what it was like 30 years ago is much different today. Even in the last 5 years, it's changed like dramatically, right? Um, and that's one angle to think about. Now, my fiance, before, she's a nurse as well. I'm surrounded by nurses in my life, but before that, she was a CNA, and she was doing long-term care, working in facilities and helping the elderly. And every day I would hear a new story about how things were, maybe there wasn't enough funding, or things were very challenging, very short-staffed. That's the most common one. It's like one person is working with 5, 6, 7, 8, 9 people at once, and it creates unsafe working conditions, and then it kind of demotivates people that want to be involved in the industry. So those are challenges, I think, largely related to what you're mentioning: more funding, better access to people, better access to care. Those kinds of things, they make an impact, and we might not see them right away, but we might see them over in the next couple of years really drive that impact that you and I are looking for in the industry. So it's never going to be a silver bullet that kind of solves anything, right? It's kind of an ongoing, you're always kind of shifting the goalposts as to what that new burning platform is to solve for. But I think the most positive thing we can learn from that is that we are trying to solve for them, and we're just kind of working with what we're given, which I think is the nature of our industry as it's been for years, right?
Right.
That's awesome, Doug. I appreciate those insights. Now, piggybacking off that one, again, can you tell us which authorities to contact for various home care provisions and benefits?
Yeah, there are a lot of different federal and state government agencies that have a hand in home care regulation and funding. And it's important for home care agency owners to understand which body does what so that they understand who to contact when they have a need. For example, if someone is operating a certified home health agency and uh, providing care to Medicare beneficiaries, then CMS, the Centers for Medicare and Medicaid Innovation Services, rather, is going to be a very important organization for them because they're setting the conditions of participation, the rules by which that agency needs to follow in order to be reimbursed. They're setting, in large part, parameters that affect reimbursement. So they're going to be very interested in what CMS is doing and communicating. Mm-hmm. They're going to have to follow CMS's rules and guidelines. And then CMS, being a federal agency, it's influenced by Congress. And Congress would be another body for those that are certified home health agencies to engage in a relationship in. So you have the House, you have the Senate, you have senators, as well as members of Congress, House representatives to contact and make your case to them about what you think CMS needs to do or not do. And then Medicaid is a funding source that's operated by CMS, but really funded and directed more so by the states. And so if someone is providing care to those receiving Medicaid benefits, they're going to want to contact their state Department of Health and Human Services or the whatever agency might be operating that Medicaid program in the state to understand the rules for Medicaid, the billing procedures, and whether or not that state exports the management of Medicaid to what are called MCOs, managed care organizations, or long-term care plans, as they might be called. Essentially, these are oftentimes insurance companies or a third-party administrator that's contracted by the state to run that Medicaid program in that state. There may even be multiple MCOs in a state operating from one county to the next. So for Medicare and Medicaid services, those would be the different groups to contact. A state agency like the Department of Health, or in California, for example, is the Department of Social Services. They run the license that needs to be obtained by the agency to provide home care. Whether it's going to be non-medical or whether it's going to be nursing and skills services, there'll be a license in most states, certainly for skilled, 33 states for non-medical, where the agency needs to get the appropriate licensing authority to provide those services. And that's oftentimes separate from getting credentialed with the Medicaid program or the MCOs that run the Medicaid program and getting credentialed with Medicare to provide care for those beneficiaries and get reimbursed by those different organizations. So you have a licensing authority, and then you have essentially a funding or reimbursement authority, and the two are different. And it's important to understand the difference between those two.
Yeah.
And then the state legislature is going to have a great impact on the Medicaid reimbursement, as well as licensing authority, which is the other state, the other issue overseen by the state government. So interacting with your state legislature is going to be important for licensing and Medicaid funding.
Mm-hmm. Yeah, all amazing points of feedback, Doug. And I think, one of the things that I hear from that is there is a lot to know, a lot to learn, and a lot to prepare for, right? Especially as we try to, for a startup agency, right? Trying to get a license, trying to get their accreditation or credentials to service different individuals, demographics, whether it's private pay, that might be the easiest one to achieve, right? You then have Medicaid, that takes a bit longer, VA, other types of qualifications or credentials you need. So like you said, there are people we can reach out to, MCOs, the state, people in Congress or our local municipality, to understand what is the process to ensure that those that need care in this type of demographic can receive it. So I think the best takeaway that I have from that is ask questions, be curious. curious because things are changing and most states operate differently. So what maybe you're familiar with in one state is largely going to be different somewhere else. So it's just that continuous learning, that continuous curiosity, I like to call it, to really understand what does it, what does success look like? What do I need to know to ensure that we can support our clients and ultimately get reimbursed or paid for those efforts as well? So amazing insights as usual, Doug. Now, the next question I have is, can you discuss any innovative approaches or programs aimed at improving accessibility and quality of home care services within the framework of those existing policies?
Yeah, I think, as I mentioned, state governments are trying to understand or create ways to provide more sources of funding. One program I think is intriguing is in California, the Cal AIM project. So the state of California has a very long wait list for in-home support, which is Medicaid home care in that state. And that wait list can be months, even as much as a year or
Wow.
more. And so Cal AIM is a new Medicaid benefit run through MCOs in California to provide in-home care to those on the wait list. So we now have home care for those on the wait list to get home care.
Yeah.
Because in large part because of the shortage of caregivers in that
Yeah.
state. There's those are reasons why that exists, that backlog exists. But I think that's innovative, and that's the state putting some real dollars against the need to help people that are needing home care right now and
Yeah.
cannot wait months and months for that benefit. So that's one thing that the state of California is doing that I think is definitely innovative.
Yeah.
And I think that there are some other opportunities out there, other services that are provided or available to participate in. It's really going to vary from one state to the next. We're seeing states come up with creative solutions for some training programs for caregivers to help elevate the profession. I think that's very helpful.
Yeah.
Again, I belong to the Moving Health Home Coalition and trying to make some changes in Congress and at the federal level that would allow for more care in the home. I think hospital at home is a needed opportunity, and that is made possible by a congressional waiver to the conditions of participation that allows acute care that would normally take place in a facility like a hospital or other skilled facility. And for the right patient at the right time, they can get the care they need at home. Technology has advanced to the point that there are a lot of devices that can work in the home setting just as well as they can in the institution. There are remote patient monitoring devices and services that make the home setting a possibility for someone with more acute care. There are different providers, paramedic type groups that can go out to the home, and hospitals are hiring for people to then staff to go out to the home setting. And with the tremendous need for more beds in hospital settings, they see the home as a great opportunity, again, for the right patient at the right time. And it's always by patient choice. It's not a requirement that they get care in the home if they don't want that.
Yeah, I think, all amazing points. And one of the things, again, that stands out to me in that conversation is technology advancement. I think more and more as technology, I mean, we see it increasing at a record pace. Even if you look 5 years ago, what was possible to now, the things you see, online or in the news or just the different types of technologies we see largely are going to impact home health care, non-medical skilled and medical services, right? And I think the opportunity now it's in its infancy, in my opinion, But the opportunity, like you mentioned, is giving more infrastructural support to maybe not having to go to a hospital or a skilled facility to get those skilled services. I can maybe get them at home because of those remote monitoring devices or other means of technology that allow us to be at home to receive the care otherwise we'd have to travel for, because that's another issue, right? Transportation. If I need to get somewhere but I don't have the means, or I can't get on a bus, or I can't call a taxi, or I need a special vehicle to transport somewhere, these are things that also can be as a hindrance to somebody that needs that kind of skilled care, whereas getting it at home might be a better avenue for it. So over time, in my opinion, as I'm sure you share, hopefully technology allows us to better support those that fit that requirement, that need.
It certainly helps.
Yeah, absolutely. And I think, me personally, just being, I'm on the software technology side now, I'm kind of a tech nerd in general. I just love everything to do with it that makes our jobs and people like yours jobs easier as well. And better access to data gives us better access to information. So I'm just hyper curious to see how those changes in technology can have an impact on us, because we're always looking for ways to get better. Especially in our industry, and even just as a quick aside, with CareSmarts, we have something that's more AI powered now, where we can give caregiver churn possibility as on reduction, or sales forecasting metrics based on how many patients you're managing and their billables and all those kinds of things. I think that's in its infancy for us, but having especially the caregiver churn idea, you can see who's more likely to maybe find additional work or not work for my agency or not provide the level of care that we know we expect, right? And these small things over time will allow us to make those impactful, meaningful decisions that ultimately, allow us to do right by our clients and support them. So, last question for you, Doug, and you've been fantastic today. Thank you for all your insight. It's such an amazing thing for us to all hear and learn from a professional like yourself. This is certainly very valuable. So I really appreciate you being so insightful and thoughtful in all of your responses. Really do appreciate that. One more question for you, Doug. What role do you think advocacy and public awareness plays in shaping home care policies? And how can listeners that are tuning in get involved in advocating for positive change in this specific area?
Yeah, I think advocacy is absolutely vital for the home care sector at this point in time, particularly at this point in time. As I mentioned, there was already a heightened awareness about the value of care in the home before the pandemic, and the pandemic just put that interest on steroids and it accelerated it at a rapid pace. And now, with also the technological developments and the potential for AI, automating things, remote patient monitoring, and the rapid advances in that field, I think care in the home is at a tipping point where it is seen as a viable setting, again, for the right patient with the right diagnoses, needing the right care. But that unloads a burden off facilities, and it provides people what they want, which is care in the home. I mean, we've seen survey after survey show that. So I think with the point in time that we're at right now, with the healthcare burden on facilities, with the interests on receiving care in the home, I think advocacy for policies that allow more of that is more vital now than ever before. It's a very exciting time to be in public policy, in home care, particularly amongst the healthcare discussions. So I think it's very much important then that home care agency owners make sure that their voice is heard, and they need to talk about the cost of care with policymakers, because I think that gets lost, right? The cost of home care, which is a service that people want, that message needs to be brought home to policymakers, for them to understand that the people that vote for them want care in the home. And so we need to have policies that make this as affordable as possible, and not just think about the other side of the equation and what the money is spent on, but rather think about how can we fund it more? How can we make it more affordable? Are those state tax credits that recipients of home care can then use to help offset the cost? Is it changes to HSA policies to allow for more care in the home to be reimbursed from those funds? What is it? We need to make it more affordable, not more costly. And we should not have regulations that are overly burdensome. We need to recognize the acuity of care that family members are providing once trained by a nurse in their home when they're a Medicare beneficiary, and realize these family members are not prepared for this. And if they could have someone in the home that can assist them and legally do so, because state licensure laws are shaped in a way to allow an unlicensed personnel to assist a family member, for example, with providing some level of care that a nurse might provide. We need to have the conversations about how we can make this happen without necessarily infringing on licensed personnel and other authorities, and to do so safely. But we just have to make the home setting as advantageous as possible for the consumers, for the patient, and for those giving that care in the home. Advocacy plays a huge role in that.
Absolutely. And I think, when you build upon that idea of public advocacy, I feel like the more and more, especially as, certain generations, get older and need healthcare, home care, or, medical services, right? As they age, the baby boomer generation, right? As an example, I think that families are going to start to really see the impact as their loved ones need that in-home assistance. And I'm even seeing that personally. I have a 95-year-old grandfather. He's a very stubborn Italian man, straight from Italy, and now he's needing assistance, and he refused to go to a facility, or he wanted that in-home care, and that for us opened up our ideas of, okay, what does it mean to provide care for him? Who do we need to find? How do we find that person that we trust, right? And honestly, it was very tough to find people that you felt were going to take amazing care of your loved one or your elderly person in your family. So I think access to individuals, access to agencies, and removing the barriers that allow agencies to do that level of work, I think is super important. And a lot of that will stem from individuals like myself and my family. When we see those challenges firsthand when trying to find care, that's when it makes you want to speak up and go to your Congress and go to your municipality and say, hey, we've seen challenges in this, this, and this. And that helps people create policy or change policy because there's more public advocacy. So I think it's such a great point. And it's something that, again, I think we'll see, as you mentioned, more and more over time, especially here in the near future. One thing, I guess the final comment I'll make on that is when you make it easier to have access to in-home care services, it also lessens the burden, as you mentioned, on facilities, on hospitals, because maybe people are less likely to go into a facility or go to the emergency room or go to a skilled area where they can then maybe have a contact that can come to their home and do it for them and lessen the burden of the actual facility unit. So that's something that I've seen very much having a positive impact with home care, is it does inadvertently and also directly lessen the burden on those hospitals or facilities that provide other skilled services too, right? But again, great point and such lovely feedback. Doug, that's all I had for you today. So I wanted to thank you for sparing your very precious time and sharing those amazing insights with us. I'm sure the audience that is going to review this and is also tuned into this is going to find this very useful. And I thank everyone who has taken the time to tune in. I thank you for tuning in, rather. Until our next episode, this is Mike, and I'll be signing off for now, and we'll tune in again very soon. Thanks, Doug.
Take care.